Hi, my name is Anne Marie Hager, and this is my Precede model follow-up for children prescribed ADHD medication. The proposed plan is increasing education and resources to not only providers, but parents, teachers, and counselors about the diagnosis and the treatment to ensure that these children are following up with their ADHD medication treatment. Identifying the desired result, our community need outcome. Rural Kansas lacks resources for mental health, such as ADHD. It is important to find assistance for families that may not have insurance or the ability to pay for prescription medications as well as their follow-ups. Proper resources to educate on treatment options, the adherence to the prescribed medications, and the importance of follow-up care for these children are essential to the management of the condition. Side effects of the medications need to be discussed and monitored closely because ADHD medications can cause weight loss and affect sleep, which stops them from taking their prescribed medications. Phase 2, identifying and setting priorities. We need to work more as a team. Resources need to be available for parents, counselors, and teachers with children struggling with ADHD leading to treatment, as well as increasing their follow-up care for the prescribed medications. There are a variety of options for prescription ADHD medications. It is essential to assess the benefits as well as the side effects that can encourage adherence to the medication, behavior change, and proper follow-up care. After treatment is prescribed, scheduling the necessary routine follow-ups at the initial appointment will help in the success of these children. We can also identify modifiable risk factors that contribute to the issue and finding alternatives to help manage ADHD along with prescribed medications. There are healthy options for food that aid in the successful development of children. School environments can be constructively modified, and interactions of teachers and parents can help children with this condition learn. Phase 3, identifying contributing factors. Factors contributing to the identified problems. ADHD affects 4 to 12% of children worldwide. Some predisposing factors is increased knowledge on the facts about ADHD medication and how it can help achieve success at home and in the classroom. Parents also need to know that medication does not mean that they have failed these children. Enabling factors, providing environments to aid in learning and behavioral outcomes. Parents and teachers can be educated to help children get the medication and the follow-up care they need. There are multiple options for ADHD medication. There is not a one-size-fits-all treatment. Reinforcing factors, primary care providers are able to evaluate the children to rule out other behavioral disorders leading to the diagnosis and the treatment of ADHD. It is also important to provide assistance with prescription medications to ensure adherence and successful outcomes for these children. Phase 4 is identifying factors that can influence implementation. Primary care providers can be equipped to diagnose and find appropriate treatment, as well as schedule follow-ups for children with ADHD. Community resources can be made available for families to seek treatment and reinforce the necessity of follow-ups with ADHD prescriptions. It is important to schedule these follow-ups to ensure that there is a relief of symptoms and the proper dosage is prescribed. Phase 4 continued. Teachers and school counselors can become actively involved with parents to provide routines that benefit their learning environment. Compliance with medications can be provided by relief options for prescription costs, and proper resources and education of parents on diagnosis, medication, and follow-ups. Here are my references, and thank you for listening.